So the first announcement I just wanted to let you all know about, very excited. We are expanding our device support at Labster. So we now support iOS as well as Chrome OS and Android operating systems. So we invite you to download the Labster app in the Apple Store or the Google Play Store and check out Labster on your iPad, Android tablet, or Chromebook. This is new this spring and summer. We know lots of students are using tablets and in some cases even smartphones, other devices. So we're excited to be able to enable folks to access Labster from anywhere. I also wanted to let you know about a special offer. We have a special offer for all those folks who are participating in the webinar today. If you like what you see in this next designer section and you do decide to purchase Labster in the future, you can get access to it this summer for free. So if you have any summer courses in which you want to try out Labster, you can have that experience. And then finally, I just wanted to let people know about our community campus at Labster. The community campus is completely free to join. You do not have to be a Labster member or user to join the community campus. It's an open forum where you can explore Labster technology, hone your virtual lab skills, connect with other science educators. You can even gain access to exclusive thought leadership opportunities, as well as classroom rewards. So we invite you all to check that out at campus.labster.com, a great way to stay in touch with Labster. And then just one more plug. At the end of the session today, we will be announcing the iPad winner. So please stick around for that if you want to have a chance to win. All right. Jamie, do we show the poll results? And then I'll turn it over for our next panel. Here we go. We asked about how often you're using 3D models, and it looks like a few times a semester is winning. Okay, so not a ton, but then a few times a week was also a pretty popular answer. So it looks like we do have some folks using 3D models, not a ton of use. That is interesting to see and definitely something we'd be curious to learn more about from you on our community campus. All right, so now I'm going to turn it over to Mark Fuller, our Director of Product Marketing at Labster, who's going to kick off our next discussion with our Labster and UBSIM design team. Thanks, Mark.
All right, thank you so much, Sarah Jane. We have multiple Sarah Janes or SJs here today, but we're so excited to give you a little bit of a peek behind the curtain at organizations like Labster and like UBSIM. And first of all, I'd like to say a massive thank you to Michelle and Yvonne and Sharon. I found that incredibly enriching discussion. I felt really, really interesting. This is an important topic, right? And I think that as we talk about sort of the future of health and healthcare in whether it's in the US or anywhere else around the world, that's a very, very powerful frame. But I'm also thinking about everyone at the beginning of this when we looked at what people are actually teaching. And it might be microbiology. It might be chemistry or biochemistry. It might be pharmacology, maybe nursing. Maybe you do teach anatomy and physiology or some other types of course. But there's a through line, I think, through all these different topics. And so we're so excited to introduce our guests here today. Maybe we could pull up our little panelist slide. But I'm going to do my best to get through this. I'll be a little intimidated, I think, by some of my colleagues here today in terms of their credentials as compared to mine. But I'm gonna give it my best shot. So first, I'd like to welcome a colleague here, Monika Starnawska. So Monika is a scientific content creator at Labster. So she works specifically on Labster's anatomy and physiology virtual lab simulations, but also supports our design teams that ensuring that our simulations are accessible, so to speak. She holds master's degrees in biotechnology and molecular biology. Next, I'd like to welcome Maria Dereko. So Dr. Maria Dereko is the Director of Simulations and Scholarship at UBISIM, an immersive virtual reality simulation platform that is dedicated to nursing education and is part of that larger Labster family. Dr. Dereko is a registered nurse and board-certified family nurse practitioner with clinical expertise in primary care across the lifespan and care of medically underserved communities in particular. And I'd also like to welcome Dr. S.J. Boulton. She's a global curriculum lead here at Labster. Before joining Labster, S.J. held a teaching fellowship at Newcastle University, where her research focused on diagnostic and therapeutic technologies and creating equitable access to learning technologies and to large cohort teaching scenarios. SJ works across multiple teams, many different teams at Labster, to help ensure our simulations and our other learning resources are fitting the actual educational needs of institutions and programs and educators like some of you all, and of course the actual students themselves. So I'd love to maybe start a little bit with, we'll start with SJ here. I'd love to ask you a question in the beginning was just, so for those who were a part of our last session, I think maybe heard some of these themes, but in your mind, what are some of the top challenges that you see or that we see at Labster when it comes to training future professionals in healthcare industries or perhaps life science industries? What kind of challenges as students do you see them encountering?
Sure. It's been a bit of a wild ride, what I've been doing in terms of market research and connecting with our educator users over the past, especially the past year, and hearing some of the woes that they're communicating around teaching, especially large cohorts within faculties of medical sciences. One of the overwhelming messages is that there seems to be scientific about it, a bimodal response in the public of students that are really truly motivated by the happenings around COVID, around the kind of heroic way that people working, for example, within the NHS here in the UK, where I am, these people have been really held up as shining examples of what you can do, applying yourself within the field of STEM. The flip side of that is kind of the media representation of just how difficult the job is, has really maybe stopped a lot of people from wanting to pursue nursing or healthcare related careers when maybe they might have in the past. So there's this really strange balance happening within the recruitment pool for those nursing courses and allied health in general. I think we're still suffering the effects a little bit of learning how to respond in the teaching environment where we have a much more diverse repertoire of students entering at stage one. And where students have had a taste of what hybrid and high flex learning done right looks like. I see a lot of teachers saying, I really want to maintain the momentum that I've built over the past 2 years. And I want to be able to offer this high flex scenario to my students. I want to give them options about how they complete their assignments, about how they engage with the course in general. Whereas in other educational institutions, maybe this return to traditional methods is a part of their strategic messaging, and they want to kind of get back to the classroom in a certain way. So there's definitely, again, this, it always seems to be two sides and it always seems to be quite polarized in the discussion. I just hope that the real winners at the end are the students and that they get onto career tracks that inspire them and help them find healthy long-term careers that really fulfill them.
That's great. Thank you. I thought that helps frame the discussion a little bit. When we talk about the actual types of teaching methods and technologies that people can use, there's a range, right? And I think in our last session, we heard a lot of different ideas and suggestions for different approaches, whether it be peer feedback or different types of online tools or simulation or role play. It's not necessarily all about, one size fits all. We heard Sharon talk a little bit about neurodiversity, I think, right? And having that diversity of teaching media and teaching tools can, I think, sometimes help reach that kind of the back seat of the class a little bit. But I'd love to maybe turn to you, Monika, and ask a little bit about how we at Labster create our simulations, right? And maybe there's some kind of instructive lesson in there about how others can apply those same types of approaches to their own curriculum, their own students, their own courses and classes, when it comes to how do I help my students understand and engage with this material a little bit better. So Monika, do you want to maybe start by giving just a really brief high-level overview of what goes into our simulations, and then maybe we can look at a short clip of one of our anatomy sims to show it off?
Yes, so there's a lot of elements that we try to integrate when we make the simulations. First of all, the scientific knowledge, the game design. So we try to make an engaging experience. And I think that this is something that really stands out, especially in A&P, where you have this vast amount of knowledge that you need to acquire, where a lot of it's just memorizing the things. And we try to group it, we try to simplify it, we try to focus on a basic concept that then can be expanded and applied in the real labs. This is what we're trying to do here. And we do it by designing activities that are engaging and giving the actual purpose. So instead of just showing off the model or a bunch of bones and muscles and giving them the names and functions, we try to build a whole narrative around it. So why we're here, what is the purpose, why you need to learn this. And also another layer of that is applying the critical thinking. So, okay, this is the muscle, this is the bone, this is the function, how I can use it, how I can get this knowledge transferred to the activity and challenge that I have in the simulation. So it's sort of guidance learning, which can be repeated. You can make mistakes, you get the immediate feedback if you do something wrong and correct. So it's not only meaningless clicking on the screens and the models, it's all of this like active guiding experience. So you really understand why something has its function, why is it in there, what is the reason behind it, and how you can apply it further in the lab or a lecture or real life scenario.
That's great. That's really helpful. And I believe we have maybe a clip of one of our recent simulations that we could speak to a little bit, if that's possible to pull that up.
Yep.
And Monika, maybe you could introduce this simulation a little bit.
Yes, so one of the recent simulations that actually applies what I just talked about is about the skeletal muscle system. So instead of just giving a 3D model of the muscles and just throwing the names and functions, we try to create
biceps brachii. It even looks like a protection cap, right? Repeat the process 3 times until all muscles.
Yep, turn the volume down. There
Great.
we go.
Thank you. So as you can see, we just don't throw a model. We focus on one concept, which is upper arm system, and we let the user play with it. Obviously, there's a narrative around it, why they need to do it, why they need to make the model function, but they learn about the functions and the functional group of muscles, and then they need to apply that knowledge to build their own system. They can play around with it, they can make mistakes. They just need to understand why something is positioned in that way and why everything needs to be put together to actually make the system contract. So there's a whole story behind it, and there's a narrative behind it, and also the reasoning, right? You can only activate the muscle if you do it correctly. So there's also this reward that you get in the end because you finish the exercise and you got the outcome that the system, the muscles contracted, they performed the movement.
That's great. And I think we have maybe one other clip if we want to pull that up briefly. But one of the questions I had for you, Monika, too, was why is wrapping it in a challenge and sort of almost a case study, why is that helpful for students and sort of what we found in our research?
Yeah, so we found that letting them explore and also guide the learning, it's a much easier experience when it comes to the vast knowledge as it is A&P. So when we focus on one system that they can apply further, it's just much easier for them to grasp the basic terms. And giving them a narrative gives them not only the reason that I need to study because I have a test, but I need to do it because I have an assistant that has trouble speaking and I need to figure out what's wrong with him. And then we guide the whole experience of the, for example, central nervous system, where they explore the brain, they explore the spine, they learn about the functions, and in the end, their outcome is that they helped someone. So it makes the learning a bit simpler, a bit more comprehensive. It also gives the reasoning, and they can always repeat it. So if some of the terms sometimes are too complicated or they didn't understand the concept quite well, they can always repeat the whole simulation.
Great. Okay. Thank you. No, that's really helpful. Maria, I'd love to turn to you now and just talk a little bit about nursing education tools and how maybe we set the table a little bit to start. If you could maybe introduce the differences between perhaps simulation for nursing and more of a introductory level undergraduate or intro level science virtual lab like you'd see in a biology or anatomy and physiology course. Can you just give us maybe a quick primer on some of the differences between those?
Yeah, so when looking at the journey of a nursing student, for example, it goes from the prerequisite courses all the way through to the lecture courses and the clinical courses where they apply all of their knowledge to care for patients. So science labs and simulations are really good for the prerequisites because scientific concepts are integrated throughout nursing care and form a solid foundation for safe patient care at the bedside. So that's anatomy and physiology, biology, chemistry, and all of those concepts. And so in order to be successful in nursing school, to graduate, pass a licensing exam, and ultimately be a safe and competent nurse, you need to have a solid foundation and master the scientific concepts. Then when you go into simulation in a nursing program, you already have that solid foundation, and now you're applying that knowledge and building upon it. So you're taking your anatomy and physiology foundation and learning about pathophysiology, what happens when the body is no longer working as we expect it to, and how can we safely and efficiently care for this patient. And so that's where nursing simulation like UBSim comes in. We are an immersive virtual reality platform. The learners go into VR and they care for very realistic virtual patients in a variety of clinical settings. And they apply all of their knowledge that they have collected throughout the entire journey of being a nursing student, from the prerequisites all the way through to their clinical education, to now care for the patient and to improve the patient's outcomes.
Great, thank you. Maybe we can show, I know we have a quick video of the UBSim VR experience, and what we'll be looking at here in just a moment is actually raw footage of the VR headset experience. So from within the experience, what students might see. So let's just maybe play this to get a bit of a visual, and then we'll jump back into the conversation.
My name is Maria Dereko, and I'm the Director of Simulation and Scholarship at UBSim, an immersive VR simulation platform dedicated to nursing education. Today, we will have a sneak peek into one of our newest and most popular scenarios about sepsis, which is a leading cause of death worldwide. Our team at UBSim created this scenario to provide a safe space where nurse learners across the globe could develop and master their sepsis assessment and treatment skills. So let's take a look at the scenario.
Hi, Mrs. Mendez.
Can you help me?
Yes, Mrs. Mendez. I'm your nurse and I'm here to help you. I'm going to start off by assessing you.
A unique feature about UBSim is there's no menu-based communication or point-and-click actions. So learners simply speak with the patient in their own words and grab a stethoscope to assess the patient as they would in a real-life clinical setting. They can administer oxygen via nasal cannula to the patient that's in respiratory distress. And they can also perform hand hygiene and don gloves before procedures. And they can implement a very important nursing action, which is to obtain blood cultures in a patient that is displaying signs and symptoms of sepsis. This is just a sneak peek of our sepsis scenario, and the learner will go on to do many more exciting and realistic actions, such as administering IV antibiotics to the patient, an IV fluid bolus, and calling the provider to further collaborate on the plan of care. Thank you for joining me in this sneak peek of the sepsis scenario, and we are very excited for you to learn more about UVSIM.
Great. All right. Well, so that's hopefully gives you some kind of sense of what UVSIM, what the experience looks like. And Maria, maybe you can speak a little bit to how simulation can be paired with actual sort of clinical practice or other types of training or teaching, other methodologies for nurses. Why is this valuable, and how can it be kind of paired up?
Yeah, so simulation provides an excellent supplement to a nursing student's real-life clinical education. Many nursing programs are increasing their matriculation rates, which is fantastic because this will help us to mitigate the global nursing shortage. But at the same time, nursing programs are facing some significant challenges in providing high-quality clinical education to their growing number of students. This is worsened by a shortage of clinical sites and a lack of standardization among clinical rotations. For example, 2 students within the same nursing cohort can have entirely different experiences in their clinicals. As Dr. Goldfarb discussed in the previous panel, one student could be in a rotation where they are mostly observing, whereas another student could be in a very hands-on clinical rotation. Or students could go through their entire clinicals without caring for patients with very common chronic conditions that they will need to care for after graduation. So UVSIM and simulation in general is really a solution for these challenges, and UVSIM provides a scalable solution for them because our platform provides high quality, standardized simulations that supplement clinical education. In simulation, the learner is in charge, as Professor Decker said perfectly in the previous panel, and that certainly is the case in our UVSIM scenarios. So we are an immersive VR simulation platform, so learners will wear a VR headset just like this, and when they don that headset, they're immersed in this very realistic virtual clinical environment. In our scenario, students provide care to the virtual patient as nurses would in a real life clinical setting, which is often a much more hands-on experience than they will ever have in their clinical rotations alone. So it's a great supplement. For example, when students are in the scenario, they can provide therapeutic communication to the patient and family member. They can assess the patient by simply picking up a stethoscope, placing it on the correct patient anatomical landmarks, and auscultating heart and lung sounds. They can implement critical nursing actions, such as administering medications and oxygen to the patient. And they can even practice teamwork. For example, in our multiplayer setting, nurse learners can work together in a scenario to care for the patient, and they can call the interdisciplinary healthcare team to further collaborate on the plan of care. So in our UVSIM scenarios, nurses can master all of these important skills in a safe environment. They can reflect on their experience during a debrief and identify key takeaways that will improve their practice moving forward. And educators have confidence in knowing that nursing students will have a high quality, standardized simulation experience that supplements clinical education, fills in any gaps in their experiences that they may not be able to have in their clinical rotations, and ultimately prepare them to be safe and competent nurses.
Okay, so a lot of different points to touch on there, but you know, among them, of course, plugging some of those gaps in the experience they may otherwise have. I think when we step back a little bit, and whether it's a solution like UVSIM or virtual labs or other kinds of technology, right? Whether it's you're dealing with different mannequins that you might interact with, or other types of, honestly, almost any type of interactive or active learning tool or solution. SJ, maybe I can ask you, how do we see these things being adopted successfully? It seems like a lot to get started with. As a former instructor, what advice would you have to someone who is perhaps like wanting to incorporate some of these types of tools, but it's just it's a lot to ask with 50,000 other things going on your to-do list before the semester begins.
I have so much empathy for folks that are trying to put together their curriculum right now and setting up new courses, especially. There's a lot of folks here in community colleges that are, you know, expanding their offer right now. So my hat is well and truly off. One of the places that I think is most valuable to start is where are you experiencing pushback from students within your curriculum? Where are you getting negative feedback, or where are you getting a lack of engagement? That's usually the best indicator that something is ripe for a change. And often going through a very light touch curriculum integration process of just trying to pinpoint which sessions, which lessons, or which labs is it that you want to boost the experience of, or boost the engagement of, or otherwise want to try different methodology with. Taking a new virtual people is that, where do the matches exist? I know for Lobster especially, and certainly I know UBSIM can do this too, we can work with you, or often the tool provider, the resource provider can offer some kind of curriculum integration assistance or mapping to really help you figure out, like, okay, which pieces can I use? Which resources are going to be useful in the first instance? So that curriculum integration piece doesn't have to take a huge amount of time, and you'll definitely get a hit, which is great. For me, if it was a lab session that I wanted to improve, when I talk to like most long-term customers and long-term partners within especially community colleges, where I see the greatest success is Labster as a pre-lab or as a primer. I know it's Felicia in Florida. She likes to use like one simulation per week that supports the theme of that week. So if the students are doing PCR, or if they're doing some kind of diagnostic type technique, they'll probably do PCR sim that week as a primer to give the foundation knowledge that will spark engagement or spark a need for doing the practical later on in the week. I know Manuela Tripepi as well. She teaches microbiology and likes to use the Labster as a likes to use Labster tools in preparation for a practical technique, because the problem she has is the students won't read the safety briefing and they won't read the handbook before they come to the lab. Labs are expensive, time in the labs are expensive, resources are tight. So anything that she can put into the curriculum that means the students arrive ready to go on the dot and can make the most of the time they're in the lab is a benefit to her. So I think that's one of the major ways that Labster is useful. I would draw attention though to that virtual lab just about practical learning, and that there's a huge amount of resource available for those tricky to visualize conceptual pieces of the curriculum too. So for example, DNA in general, it can be really abstract, like why does it bind in the way that it does? Why do we have base pair? And all these kinds of questions that nobody really wants to ask their teacher for fear of looking a little bit silly. A lot of resources are there to kind of visualize these hidden concepts and address the learning gaps that might exist and that are becoming more prevalent or becoming observed a little bit more frequently, especially as students have missed perhaps months or have big long multiple week-long gaps in their education in high school and are now entering college. And often on subjects that the student might perceive as very basic or simple, and there's a behavioural piece there in not wanting to reach out and get help for something that's perceived as very simple. So these conceptual simulations or conceptual labs that kind of visualise abstract concepts, allow people to really wrap their head around what it is that they're learning, can be a really good tool for learning loss mitigation, or just giving a student a little boost where it's noticed that they might be lacking in some of the core knowledge to truly succeed in a higher level course. So I think those two things are really useful. Gap conceptual simulations for gap fixing and gap filling, learning loss addressment, and then preparation for wet lab scenarios so that you can truly make the most of the resources, or the scant resources often that we have in those wet lab experiences that are increasingly expensive. So yeah, two really good ways of getting it in there.
That's really helpful, and I think it's really interesting to think about that wide range between experiences, whether it's a doctor's office, or it's a nursing situation, or a lab bench that you're simulating, and you're simulating an actual real life activity or environment. all the way to what Yvonne was talking about in the last session, which is something as simple as making the invisible visible and understandable, right? So I think that's really, really interesting point. So now I think I would love to begin taking some audience questions. So if you could please enter your questions into the Q&A. I may jump around a little bit. If we're not able to get to it here, we'll certainly follow up after the fact. We're going to probably close up shop in another 13 or 14 minutes here. But one question I have, and this could be potentially for anybody, but what is the advantage of using Labster over free resources I can find, like videos? I try to use free tools if possible, and I think it's very understandable, especially given the kind of budget situation that a lot of students in, especially at their community colleges. So I'm interested, SJ, or potentially even coming from the UBSM angle, if Maria, you have anything to add.
Happy for Maria to jump in, but I'm happy to give an answer too.
Go for it, SJ. Sure.
So I've just noticed the question about pharmacology as well. Leave that one to one side. My own heart there. I think what's really unique about Labster is what Monika highlighted. The fact that we have this guided learning experience that truly contextualizes the knowledge and the practice within something that makes sense and that is relevant on a cultural level, on an environmental level, on a personal level. It really takes the science and makes it tangible. You can watch a video and that's great. You can pause and you can rewind and you can look to see how something's done, but that's very different from making a decision yourself and committing to it and then failing. Like, it's okay to fail. You can fail in the safety of your own home where only you and your instructor knows. And I think that's really, really valuable. You can get your fails out on the quiet rather than failing in public, which is always a nerve-wracker, especially for folks like me. So I think the benefit of something where every interaction matters in the scenario, that really progresses a storyline and progresses an experience, means that there is no passive way to engage with the content. You can't just like sit back and think that it's going to go into your head by osmosis. Like, you have to engage with this and have to make decisions. And every little touch point on those brains is going to help embed that knowledge that little bit deeper, make links between different types of knowledge, and really construct a foundational mental model that is meaningful and can be built on later too. So yeah, something that videos can't do, that static images can't do. Yeah, simulations have a lot to answer for.
And Maria, anything you would add on the nursing side?
Yeah, so when you do a UBSIM scenario, it's written by nursing experts in simulation education. Our team is really in tune with the nursing curriculum, which can be changing and evolving as healthcare changes and evolves. And so we do a lot of work to make it a structured simulation-based experience where it's not just the VR scenario itself, which is amazing, but you have structured preparation activities that establish psychological safety and prepare your learners to attain the objectives, to a briefing to help them gather their thoughts and get ready to start the scenario. And then afterwards, we have a debriefing where they're able to reflect and see what they did right, what could be improved upon, so they can identify key takeaways to improve their practice. And we also have unfolding case studies that are designed to develop clinical judgment. They're aligned with the next generation NCLEX test items. And so all of this combines into this very robust experience that ties into the curriculum and will really prepare your students not only to succeed in their nursing program, but to pass the licensing exam and then enter practice as a safe nurse.
That's great. That's really helpful, kind of framing a little bit of what you actually get as part of the platform. I think another question that I noticed in here was just, and referring back to the previous session, was how do some of these tools potentially help? Part of this may be making the case that they could be worthwhile, perhaps to an administrator or someone else. There were, I believe it was possibly Sharon or Michelle who made reference to this before. But if your average student age is 32 or 27, if your students are perhaps non-traditional students, they may be working day jobs, maybe taking care of family, how do these types of tools perhaps help non-traditional students succeed? And that could be for SJ, Monica, anybody who wants to jump in.
I definitely have thoughts on this as a non-traditional student myself. One of the biggest challenges from the administrative or the dean side of the table is certainly student attrition, student commitment, student completion, and ultimately the commencement rate of a program. And I sympathize that you can have a lot of bums on seats on a course, and it can be really difficult, especially with folks that have that non-traditional background that might have other things going on in their lives, actually committing to finishing programs or even finishing credit hours themselves. Where I think Lobster can help is you don't have to be on campus to do this, and you can still have a meaningful learning experience at home. As long as you've got a laptop and an internet connection, you can access a Lobster simulation, play through a simulation, complete a resource, for example, using the lab reports alongside the simulation. That whole play experience, reflection, assessment, and then assignment submission can be done from the comfort of home, maybe in between school drop-offs, you know, or in between other shifts at work. You know, if you've got stuff on, it's something where there's an opportunity for asynchronous learning. It's hard for an educator to be on the student all the time. And one of the benefits of the guided learning experience is its incorporation, much Maria just highlighted with UBSIM, that the reflective practice is built into the through a foundation, a Kolb's learning cycle, where we're providing a concrete experience, virtual concrete experience in terms of a practical exercise and activity, or maybe even a benchtop experiment, and then promoting reflective observation through the use of quiz questions or secondary activities. The student always has an opportunity to reflect on this in group work. Again, that could be asynchronous using a VLE alongside or embedding Lobster within the VLE. So that a student can either go into a different simulated experience or another learning activity, having reflected upon and synthesized knowledge from that primary experience. And that can be done anywhere, where there's an internet connection on a laptop or an iPad now. I think if one of the major drivers of attrition or the major dropout reasons for an institution or for an administrator is around non-traditional students not having the time or being able to commit or being pushed, this is an opportunity to create a little flexibility and build some equity for those students and help them achieve the success that they're looking for.
Absolutely. No, that's
positive outcomes for everybody.
Exactly, which I think is so many institutions are thinking about and frankly worrying about right now. And Monica, is there anything that you would add at all on just like technical access and accessibility side of things? So I know you're focusing on that.
Yeah, so when it comes to accessibility and what SJ mentioned, that anyone with a laptop and internet connection can play, it's a very multi-layer approach that we're having. Like, first of all, we try to design simulations that can be applied in multiple courses and programs. So we're trying to do a universal class style where the knowledge can be applied in many different fields. Another way, also what SJ mentioned, that you can play it anytime. So the simulation is accessible not only on campus, not during the lecture, but you can use it before the exam, before the lab, after the lab, as a preparation, as a reminder, as a test yourself. So this is the second layer. And the last one is that we are taking accessibility, the approach to make simulations accessible, very seriously at Labster, and we are continuously trying to improve our catalog for students with various impairments that could also play the simulations, with low vision, with hearing disabilities, with different assistive technologies that could use. We're trying to constantly meet all the guidelines and standards and make it compatible with as many assistive technologies as possible. So literally every student could play the simulation, be familiar with the topic, be on the same level of knowledge. So we're trying to open these doors to as many students as possible.
That's great. Thank you. I have a couple of questions here, and this is last call because we really have to wrap up in just a couple of minutes. But is Labster developing a case-based series for microbiology or immunology? In terms of what we have for microbiology, immunology, maybe SJ, you can speak to that because I believe you might have been involved in some of what we have.
I actually joined Labster in 2019 to put together the microbiology package. So the microbiology package is very close to my heart. Whenever I see it popped up, yeah, it's grand. The approach to microbiology is one that focused on core techniques. It was inspired by some of the standards and guidelines that are in the UK for biomedical sciences practice. And also looking at different assays like the Kirby-Bauer assay, looking at minimum inhibitory concentration values, things like this, that were important not just to clinical laboratory sciences or microbiology in the clinical setting, but also to research practices as well for drug development, for cleanliness in the laboratory, that kind of thing. Many of the simulations actually work on a case basis. For example, a control microbial growth sim, and that focuses on a case of trying to clean cleanliness in a dental practice. I believe there's another that's on trying to find an appropriate antibiotic for treating a streptococcal infection and investigating what dose is appropriate through minimum inhibitory concentration. So while at the moment there's no big plan in the next 6 months, certainly, to build any new microbiology simulations, what we do recognize is that clinical laboratory sciences and the clinical medical laboratory side of allied healthcare is something that Labster is really well suited to serve, and especially in combination with UBSIM, where Labster kind of has the opportunity to help out with the prereqs, and UBSIM can serve you afterwards and get you into being the solid practitioner, competent beginner that you want to be. I think there's a lot of opportunity there to really look to allied health and look at cases specifically within clinical laboratory contexts and build out some new scenarios in the future. Keep an eye on 2023, friends.
and the same is true. I think we have some questions in here about comparative anatomy and pharmacology, so we could follow up separately about those as well.
I have been dying to make a volume of distribution sim for like 3 years now, so hopefully we'll get to do it soon.
The great part about working at Labster is that we have scientists who like to nerd out about science and who really get excited about this stuff in a great way, right? And so I think that that's what we're really excited about getting the latest set, whether it's more microbiology or pharmacology or anatomy or nursing simulations, out to you all. So, all right, maybe we have just time for one more question. I'm just checking the list here. Just a technical question about Labster being able to assign to a specific student instead of the whole class. Right now it is not. Right now it's almost like building a syllabus where you have an entire group together. You can assign different simulations, but you are able to create separate kind of courses for an individual student if they, as perhaps a subgroup of students within your course or your class needs to look at, perhaps some remedial simulations or some more advanced simulations, or you want to segment the group a little bit. So you can definitely do that within the platform, or certainly if you have an LMS, you can do almost anything that you want. So thank you so much. I know we've run out of time here. It was an action-packed couple of hours, I think, but really appreciate it. Please go to our website, go to ubisim.vr, I believe the URL is, correct me if I'm wrong, Maria, and labster.com to learn a little bit more, sign up, get free trial access. You can simply just sign up and get approved within, perhaps a few hours to take a look at the platform. Send us your notes, your emails, reach out to us, and we'll be happy to try to answer any question that wasn't answered here today and anything that you or your colleagues may be interested in the future. So again, a massive thank you to Maria, Monica, SJ, also Sharon, Michelle, and Yvonne. Thank you all so much for joining us, and we'll see you soon, we hope.
Before we go.
Yes.
Before we go, I want to announce our iPad winner. You all stuck around. Those of you who stuck around to the end, our iPad winner is Ibrahim Ikaidi. I apologize if I'm pronouncing that incorrectly, but Ibrahim, we will follow up with you to deliver your new iPad Air. So congrats to you. And thanks everyone for joining. A reminder about, congrats, a reminder about our new expanded access on tablet devices. And then just a couple housekeeping items. You should have seen Jamie add a link for a survey in the chat. We'll also send it in the follow-up email, but we would love to know what you thought of this webinar so we can improve it for future sessions. I'll say one more time that we'll send the recording in the follow-up email, so don't worry. I know I had a number of folks asking for it. I also had a number of you asking, interested in trying Labster or UBSIM in your classroom. We'll give you all the resources, all the links to do that afterward. And please stay tuned for upcoming events in the Global Issues series and on our website. I think that is it, unless anyone else has some parting words. We know it was a bit of a long session today, so thanks for sitting tight for 2 hours. We hope you found it informative and educational, and we hope to see you all again soon.